And the faculty of today's session is Ms. Preeti. She's a PhD scholar, psychological counselor, and the head of policy and strategy department in Bali, India. I think we all know her very well from our last few sessions. So warm welcome, ma'am.
I'll get back here in 5 minutes. I'm wrapping up other meeting on call. May I?
Yes, ma'am, please.
Yes, thank you. My name is Preeti Chauhan. As earlier, I think we did risk assessment last time, suicide risk assessment, right?
Yes, ma'am.
Okay, today we'll be doing suicide risk management. Can I have sharing right, please?
Yes, ma'am. Please, ma'am, you can share now.
Thank you. I'm going to share a case study today. So for management purposes, I've taken off case studies that we get in the hospital setting, particularly in clinical settings. But there are a few cases which we usually get in in our helpline or normal counseling cases. So I'll be showing them today, and let's see how all of you observe cases and observe the symptoms and things like that. I won't get more into detail right now. We'll discuss it later once you've gone through the study. So I'll be sharing it here on screen for you all to see. I hope this is readable to everyone, or should I just copy paste it in the chat box?
It's readable, ma'am.
Okay.
Ma'am, if you can, please zoom it. Hello, ma'am. Am I audible?
Yes, you are. I'm just
Ma'am, please put it in the chat box. I think it won't be readable for others.
Okay.
Okay, thank you, ma'am. Hello, everyone. The presentation is being shared on the chat. You can read it there.
I hope everyone read it. If it's done, I'll stop sharing. All right, so this is just the first case study that we're sharing here. It is about a young girl. Uh, as you've read from stages of what has happened, I want you to write few symptoms that might occur gradually through the years in this patient, and what might be the issue with this patient. That's what I want you to understand. Like, what could be the problem? I understand that some of you are of medical background, some of you are coming from general background. You can write whatever your observations about these case studies are. I want three observations from you. First question is basically, uh, do you think that this person's daily life has been affected? First question is that. Second question, do you think this person may think of committing suicide in near future or not? Third question, do you think this patient might be in danger of self harm or going into a delusional state? Delusional state is basically away from reality. So if they may have this concept of false belief that their person whom they loved might come back to them and they might get married, or some other sort of problem that they may encounter later in future. So this sort of thing, do you think this person may be vulnerable for? When I say daily functioning, I'm talking about self-care. I'm talking about the things that they might be doing in their daily life, like a job, official job, or studying, if that's one of your doubts.
Preeti ma'am, there are a few responses in the chat box. Please check it.
Yeah, I'm going through it. Some of them has said yes to all. Some of them has said second for yes, all three yes. I'm looking at all of your responses. The, the answer to all three questions is actually yes itself. For management of such cases, what do you think is the best way forward? If such case you observe in your community, what is your first response? Amal Raj says suicide is a possibility, definitely. Uh, Saju Thomas has written, give hope in case of such cases you observe around you. Psychiatric assessment and therapy, Amal Raj. If this is happening in your community, like around you, what would be your first response? You can say it in your, like, you can unmute yourself and talk about it, or you can just write it in the chat box as well. Because for the first response, giving hope is definitely right. Yes. Psychiatric assessment is based upon referral and family's understanding for going forward. Harpreet says she needs a lot of love and counseling, make way for ventilation. Right. So you sort of understand that two things are necessary here. One is having support system, either from the family or from around her, or anybody could give a particular support system is necessary so that she can talk and ventilate her feelings. Second thing is medical or psychiatric help. That's the second stage after your assessment. So what I want you to understand from this is basically that when such cases come in with around you in your community, not in a hospital setting, not in a clinic, but around you in community, suggestions are the only things that you can give. Guidance is the only thing that you can give. with your support, because making them understand what is going on is one part of it. Them understanding it and doing something about it is the second part of it, right? So this is your first response or first aid for the family, is basically to consult them or counsel them on what is happening, to make them aware of the situation and what is required going forward. Now making them it sometimes family will deny altogether, because this issue is obviously related to many social stereotypes that we have around in our community. They may want to hide it also, because the girl is of marriageable age, so they don't want to showcase this issue in community, or even in in a going forward in the hospital. Taking her to a hospital may be an issue altogether, because this obviously is a problem of for the family attaching itself from mental health, or the girl is ill, the young girl is ill. So that's a problem in our community, they don't want to show it, so they may say no altogether. So how to go forward with it is completely dependent on family's response as well. Your job is just to consult them and counsel them. If they do not agree, you can try and convince them from point to point, but you cannot be rigid, or have a firm stand on it, because that doesn't really work in these cases. Because later on, even if they do admit the person in the hospital and the result is not very positive, for example, the condition of the girl is manageable but not really, she doesn't get better, right? And the doctor says that, oh, this person has this particular disorder and they may have to be on medicine for lifelong. The family will furthermore blame you that, oh, you sent us to the hospital but nothing has happened and now we are stuck with this condition. Sometimes it comes to positive results when like immediate response is given to such cases and things are done in order particularly, and everything is going well for the family is becoming very supportive, and they take her to a hospital and give her the support that's needed, and doctors give medication and she gets better. Then that's a positive outcome from your efforts and from family's effort. So it can go both ways, and managing it earlier is best possibility for you, but in the follow-ups it becomes a problem. If you are a neighbor, if you are a relative, if you are a community member, even if you're an immediate family member, you will be in a vulnerable state in such cases, because people look for blame everywhere, be it a doctor or be it the person who has sent them to a doctor. So I want you to be particularly aware about it going forward in this session, that management of any case really depends on the people who are involved in it. And your involvement, if you're a professional, there are certain standard procedures that you need to follow. Definitely ethical guidelines are there as well. But if you are in a family member sort of in the situation itself, then those guidelines don't really apply to you. When you're a neighbor, it doesn't really matter, right? So these are the things that you should be aware when we are talking about management of such cases, because these cases mostly come forward around us rather than in a hospital setting. People take patients to hospital in the last condition, when their functionality has damaged altogether and they're not able to manage their daily life, when the condition has become more serious and unmanageable at home or a clinic, they then take the patient to the hospital. In suicide cases, mostly it comes when person has tried to commit suicide or has committed suicide and is in an unconscious state, or has done some self injury. That's when the families bring people to the hospital, not particularly in psychiatric unit. They'll bring them in the general emergency unit. and then it becomes a legal case, because in India suicide is basically illegal and has legal repercussions for the family as well. When a child is involved, then child welfare committee gets notified in the district particularly, and state guidelines are followed for those cases. So these things you should be mindful of. Let's talk about this case in general in other communities, in marginalized communities, right? Suppose this has happened to a girl who's uneducated living in Rajasthan in a village, right? And you're practicing in Jaipur, or you're practicing, imagine yourself practicing in a city area of Rajasthan, but this girl has come from village and the family has brought her in this same condition to you. What would you do as a social worker, as a community worker, and third, as a medical professional? What will you do in this case? You can write it in the chat, or you can just talk about it by unmuting yourself. I'm not asking for a treatment plan. I'm asking what would be your response to this case? In the meanwhile, I'll share the symptoms as well with you for this case. Harpreet has a question. Why would a rural background be different? Huge difference when it comes to rural areas of India. Sometimes, first of all, these things, if at all happened in the family, that the girl's marriage has been cancelled, it's a big stigma for the family. They don't even want the girl to go out of the house. Especially in Rajasthan, unless and until it is the marriage of the girl, they wouldn't let her out of the house. Uh, or worse, the girl may face abuse within the family, that there must be some reason why your wedding was cancelled, and tell us that reason. So the whole blame would be on the girl. So apart from having these mental health issues, she would be facing these difficulties from the family. If the family is supportive, then that the scenario would be different. They will understand the girl's situation and try and support her as much as possible, bring her to the hospital if at all they feel or are aware that this condition needs medical attention. If they come to you in a big city hospital, then your counseling would differ, your response to them would differ. How? The girl is uneducated, the family is uneducated about the condition, then you will be saying, okay, this problem happens because of these reasons, and mental illnesses, as any other physical illness, require time to heal, right? And then you will counsel them about that this is not uh, something that may stigmatize the girl later, or may have difficulty in her later life, or how they can deal with the difficulties in her later life. Because if you look at the presenting chief complaints here: difficulty in falling asleep, nightmares and intense distress, loss of interest in activities, low appetite, nausea, sweating, uneasiness, irritability, and aggression. These are the presenting chief complaints for the patient. So you may try and make the family understand why she was triggered when they asked her to go to a wedding, why her distress increased when something like that happened, right? So let's go back to the story. The first para says that she was staying with her mother alone. That means that she doesn't have any other support, and her mother is her biggest support in the family. She was in a relationship and was about to get married. For some difference among the family, her marriage was called off, and the boy left her without any explanation. She seemed well, taking care of herself and everything. But she stopped talking to the family members and friends. That means she also stopped communicating with the mother, started staying quiet in the room. It means that she stopped communication and became silent, different from her previous personality. These complaints are now. And then, when this is like going gradually into depression, these are more of depressive symptoms at this point. And then there is a trigger. There was family function she was invited to, and a wedding that triggered her response of panic or manic state, get taking her like her response from the history here. She got into manic state, she was panicked, and she was very much distressed about going there. It took a while for them to calm her down. Then later she became quieter and quieter every single day. Bad dreams, shouts, wants to end her life. So at one point, you can see the hopelessness in this sentence. She once said that she has no future, means hopelessness. She wants to end her life, means deliberate thoughts of ending one's life leading to suicide. So suicidal ideations are present. When her mother tried to console her, she became uncontrollable and started breathing heavily. Panic symptoms are there. Now, anxiety symptoms sometimes do lead to further distress. Like, for example, when a person tries to calm themselves down, they do hurt themselves. But those injuries are categorized as self injury. But when a person is saying they want to end their life because they're hopeless, that is a immediate red sign for a case of suicide. A doctor, a medical professional will be able to understand this better, but for general, I'm talking in very layman terms with you, that it's very easy to observe symptoms of hopelessness. Understanding a person's talks about killing oneself or harming oneself, and knowing that the trigger is somewhere in the situation that they're living in or the condition that they're living in. I hope I was able to answer your question, Harpreet, about the rural condition. So when a city family comes to you, it is very different. Counseling that you give or response is quite different, because it takes less effort to make them understand. Sometimes it's easier to make them understand the situation. Sometimes the city families are too stubborn to take any steps in these cases, so it becomes difficult. But in rural cases, it takes a lot of effort to make them understand what is going on, why it is happening, how going forward it should be managed, and then when they take her back home, what they can do, right? So it is more of making them aware and giving them knowledge. We call it psychoeducation in psychology, but it is sort of an orientation only to make them understand how the patient should be cared for at home. Like in any other disease, for example, if a person is suffering from lifestyle disorder like sugar, like diabetes, how a patient, if they take insulin, how they should manage at home. If they don't take insulin, what nutrition they should take at home. Such things apply to mental health patients as well, and it's easier for to make an urban patient understand it rather than a rural patient. So that's the difference. And especially in Rajasthan, Rajasthan has the highest rates of women suicide in India, but they are unreported, and problem also arises that there is a huge gap between middle class and upper class and the poor class, right? There is a caste problem as well. Many other issues, health facilities differ. Rajasthan is a huge state, but when you look at their health facilities, they're only available in bigger cities. In the smaller states, like in block areas or district areas, the families don't even approach the health centers unless the condition is completely severe, or if it is about say natal care, right? Okay, so I'll stop sharing here this case. I want you to, if at all you all have an example uh, of somebody saying to you that because they're not happy in their life or how things are going in their life, they want to end their life. I want you to write one if you heard it from anybody at all in your life. In the chat box, please write one. I am looking at the chat. Uh, what I want you to write is basically if you've heard a person say they're not happy and they want to commit suicide or they want to harm themselves, I want you to write one in the chat. Yes, so 3 ones and 2 cases, so that makes it 5. The percentage of people around us who are unhappy is quite high. I can here bet that every one of us heard at some point in our life have heard somebody say, "Oh, I have had enough of this. Ya to Bhagwan mujhe utha le," means that God should take my life or I should do suicide. So every one of us has heard that sentence in our life once from somebody at least. It really depends on what age we've heard that or from whom we have heard that, but it is this kind of tendency is present in everyone around us. So when the question arises that who is the person who's the most capable person around us for to do suicide, I usually give an example that every one of us is capable of doing it. because every one of us, life goes like up and down, right? For every one of us. So every one of us is capable of doing it. It depends on our coping system at the time of the situation that triggered it. It depends on that how our life will go, how our choices will be. People are vulnerable in life at different stages, right? And say you never expect a person who's highly educated to take this step. However, mostly the reported suicide apart from farmers are from highly educated people, engineers, doctors, people who are working in multinational companies, right? So every one of us is capable, and the percentage then differs, because what you would see reported in statistics in a newspaper article or in a government website, you add 30% more to it to understand the unreported cases. You add 30% more to it and know that, okay, this much is shown and reported in the police stations or around our community. And then you add 30% more to understand that these are the hidden cases that have never come up. So there's this story Swanlata has shared about, or a case, a widow who comes, one of my son's class 12 fell off 10th floor because she failed in maths. She died on the spot. On a later reevaluation, she had scored 92. Very sad to lose a life. Obviously, it is tragic when we hear such cases where it's a waste of life, basically, where we understand that the person was brilliant, but somehow this happened, and they made a choice at this point. And last time when I had a session, I was talking about impulsivity. So these decisions to take one's life, they require a lot of courage and a certain amount of aggression, which we're going to talk about in the next case that we'll share here. A certain amount of aggression in the sense that aggression for oneself, to feel that worthlessness, and aggression towards the situation or society that we are going to blame for our decisions. And that's where impulsivity comes in. So once you are that angry and hopeless and think that this is all you're going to get out of life, and it is time to make a decision to end it or continue with it, and you choose ending it, that's where your impulsivity helps in giving you the courage or dare, per se, to actually commit it. I have a funny message from WhatsApp yesterday. One of my friends sent an article where a very esteemed science astrological institute, astronomy institute in India, has decided to take off all fans in their building, student building, like hostel building, because they were receiving a lot of reports about suicide cases and attempted suicide in their hostels. So they decided to remove the fans. Now, I found it very funny, because that's really not a good response coming from such a highly esteemed organization or varsity. What do you think about it? Is the response right? What should have they done? What could have been different in this case? Because as all of you know, going into such a highly esteemed institute, masters engineering master students, and highly educated people who get into it are intellectually quite capable of building coping strategies during COVID for themselves. What could be lacking? I have a raised hand. Pratibha wants to say something. Please, Pratibha, you can just unmute yourself and talk about it.
I think I've also recently come across this news article, and I'm also a practicing psychologist, and I share the same view as you that it is quite ironical to see such a thing coming from an esteemed institute, because they're not addressing the why behind the suicide rates in students. Rather than just taking the fans down, they should be addressing the why, as to why this is taking place and how we can work upon this issue. That is something that needs to be addressed here and not the fans.
Absolutely, Pratibha. I agree with you completely. And that's what I was thinking and discussing with my friends and colleagues as well, that what they could have done is addressed why it is happening and give them the support that they need. And then Gautami is also writing here in chat that trying to tackle symptoms instead of handling issue at the root. Absolutely, you're right, Gautami. They're just putting a band-aid on a wound that needs sewing, right? So what could they do? I also read that they were providing counseling services, but when I got involved more into it and learned more, I realized that they were just having one counselor for 200 students who came in once in a week for 3 hours or 2 hours. How are you going to give service to at least, say, out of 200 people, even if 15 people required service of a counselor? How can the counselor manage their hours? Because when you're counseling somebody, it takes time. Even if you're sitting down with a friend and counseling them, say, just giving your guidance to them, it takes you more than 40 minutes to understand the issue altogether, then to give your guidance. So distributing those hours amongst 200 students is impossibility. So our response to the situation at hand is quite lacking, and people who are sitting at the table of making decisions are trying to undermine the requirements that our population has, even during COVID times. And COVID has had an impact on a lot of lives. Some of us has lost loved ones. Some of us has have lost people who are acquaintances to us. We've all been impacted by it, and it's going to gradually catch up to us. So are we ready for a good response to that? The way strategy is going, the way government planning is going, the way communities are coming together and behaving, sometimes the situation feels to be quite positive, but it's not a strategic response. A long-term strategic response requires sitting down and training at a larger scale, which is lacking at this point, especially in mental health. So that's what we're doing right now. In one of the Harvard researches recently, I read that the suicide rates after 5 years are going to increase 64%, because people's daily lives and functionalities have been impacted really badly. For people who loved traveling, for example, who had a job of traveling, sitting at home for more than 2 years has been quite a strain. In people's ages, it has been said that people who have been at home and in the lockdown especially, or are giving emergency services, or medical professionals, have aged biologically more than normal. For example, if you're 24 years old 2 years back, now you may become after 2 years 24, but you will feel like a 28-year-old. So although the problems make us wiser, they also make us age at a rapid rate, right? Let's talk about the case that I was going to share with you next. It may be a very common situation, so you can just have a look at it that way. I will also share it in the chat. Is everyone able to read this?
Yes, ma'am, it's readable.
Okay, please let me know when to scroll. I'll give you all 1 minute.
Ma'am, you can scroll down.
All right, I'll stop sharing here. I hope that everyone read the case. I will also give a background on what the person was education or the financial status was. So he is a financial consultant after doing his masters, and he has had about 8 years of work experience. His income is like middle economic condition, you can say 60 to 80,000 income. Only he is individually, and then his wife earns more than him. High economic status, coming from the like higher middle class family. So people who have not had experience in like psychological history taking, or even like mental status examination, or coming from general courses, I would say that this is just a way of how like we teach our interns to take history and everything. And the so this is written by a student, uh, how they've heard the story. So this is a very raw um, description of history of a person. So it's easier for you to understand that when a case comes to you, this is how they will tell you what is happening. Um, if you've gone through it, let's talk about the main points here. Do you think that this person is vulnerable to suicide at any point? It's a bit difficult conclusion to make, but Sonlata says yes. Amal Raj says guess not. Harpreet says don't think so. Um, Saju Thomas says too early to say. So, like I said earlier, everyone is capable of doing or taking this step for sure. But in his condition, currently it's difficult to say anything because we don't have a particular diagnosis for his condition yet. And his behavior is more of aggressive and more of giving like importance to himself. Um, so basically, this person is putting too much importance on self. That means his self esteem is higher than normal, but there is a hidden condition. He does not have self confidence, um, confidence in others, and confidence in self. These are two separate things. So when he has self confidence, he believes what he's understanding and what he's perceiving is correct, and what others are telling him, he's doubtful of that. Um, Harpreet says gender discrimination here is the root cause. In all probability, he will harm his wife rather than himself. That is more conclusive answer. If he gets frustrated with his wife promotion, he might do it. If threatened by providing him wrong as an emotional blackmail, he could resort to self-harm. That's true. Mm, right. So all of you have come to the right conclusion actually. uh, I'll tell you more about this case. So, what happened later? This person came to the psychiatrist, started taking medicines. Obviously, there were a lot of like psychiatric symptoms. I won't get into more in that. What I would say is that he was on psychiatric treatment for a while, but he had developed symptoms of persecution, means that he believed that his wife is also trying to kill him. And his friend, who by the way he never stopped talking to, and he was involved with his friend as well, in the sense that he kept talking to him every single day, and trying to discern when his friend is meeting his wife, when he'll be coming to his house, trying to invite him when he's present in the house. But the situation kept deteriorating despite taking medicines and despite all the effort the family has put in. Now, if you've read the case, I want you to write down, do you remember whether the person was in a nuclear family living alone in a flat, or do you remember him to be living with his family alongside parents? Don't cheat in the chat. It's written, so don't cheat. Just write if you remember it. Yes, he was living in a nuclear family, Amalraj. Uh, so it's not specifically mentioned, but the way they were describing the history, you can conclude or deduce from your assessment that he was living just with his wife. But the family members are there in the loop of what is happening. That's why he was in the hospital. He came to the hospital with the support system. Then he became more and more delusional, and at some point suffered from hallucinations also. So that became like a deteriorating condition like 2 through 3 years down the line. um, After getting better or in a manageable condition, he went back after one admission, and he joined his job and seemed to be doing quite well. But one day he decided to take his and his wife's life. He decided that it was enough, and he's not sick, and it is all the fault of his wife because she has given him some medicines in the food, and that's how he got sick, and he's not sick and she's making him sick. So that's what he decided, and he turned on the gas in the flat and used uh, lighter to start the fire. Good thing about flats these days in Gurgaon especially, so this case is of Gurgaon. The best part is they have fire hazard services available 24/7. That means that the authorities understood what was happening. Oh, I missed a point. He mixed his medication, sleep medication, into his wife's food during dinner, and she was asleep. So she didn't know what was happening and what he was doing, but that's what he did. He did become abusive verbally, but he had never physically abused her, in the sense that there was not exactly domestic violence, physical domestic violence, but there was emotional abuse in this condition, and he was diagnosed with bipolar disorder. So bipolar disorder is a manic depressive condition when a person goes into depression for a certain period, becomes hopeless, and then at some point he becomes manic, in the sense that they become very happy, very excited in the state, or become very energetic. So that sort of condition he was suffering from, but his condition was much more severe, and he never had any like, once his condition worsened, he never really did get better or got out of it. So this was the last thing that had happened. The problem was that he suffered from about 30% burns on his body, and after that his wife divorced him, and after that, like, his family is taking care of him in the village that they belong to. He's still going through the same issues, but he still believes the story that was playing in his head. He still believes that. So this is a typical mental health condition uh, that comes in a psychiatric unit once in a while. But yeah, so every patient, every psychiatric patient, or every normal person at some point in their life are capable of doing it. Dr. Nupur says, didn't this kind of work depress you? Why did you do this kind of work? So Dr. Nupur, well, to tell you the truthfully, like, when you choose certain kind of line of work, you became a doctor. Certainly you must have your own motivations for working in the medical field, or if you're not medical, like not working in medical field, social field, or any other field, there must be some kind of motivation that you got here. Same kind of motivation I got. My father is schizophrenic, so I was quite motivated to do either work in the medical field or in psychology per se. But yeah, well, this kind of cases don't really depress me, because I'm more thinking more about the people who are actually going through it. Because in their own world, even if they are in their own world, it's depressive for them to go through it, and to see them going through it and struggling, the family and everybody else. For me, it's more, obviously more efforts are required from our side, but no, it's not really depressive in the sense, because I am not directly impacted by it, although I deal with these cases. So what happens at the end of the day, you get desensitized to people's situation. So if a normal friend is coming to you and saying, oh, had a breakup and I am feeling bad about it, that becomes less of an issue to you as a person. Or if somebody comes to you and says, okay, I failed an exam, or say I failed net exam, I failed some entrance exam, that becomes less of an issue to you when you're working in such kind of situations. And that is a work altogether. Like, I take care of myself well, I give myself time. I don't do that work 24/7. I give particular hours to that work, and that's the work is there at the hospital. And this has happened after 12 years of working in the same field. So that means that it's a learning process. Wherever you go, you will feel difficulty, but if you put yourself as priority, it is just, it happens. So that's for your answer. And to make you understand also that whatever you do, uh, professionally or personally, you should be your own priority, because if you are healthy and if you are well, you will be able to take care of everything else altogether. Give yourself break, go on vacations on New Year, do whatever it takes to make yourself happy, so that you are a functional individual at the end of the day, which is the best for your family and professionally for your office also. You get to be more productive. Let's talk about your understanding so far. What do you think you have taken out of this session so far? Like, will you be able to manage? These are the two severe cases that I showed you. Normal cases we'll discuss in a short while, but I want to understand, have you gotten some sense of what you must be doing when you get these cases, or what are the common mistakes we usually make when you get such cases? Thank you, Nupur, for asking the question. Actually, anything that you guys want to ask specifically so far?
Ma'am, I have a question. May I?
Yes, 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 same.
Yeah, so the first case you were talking about, you said the urban and rural, but even in urban areas, there's this taboo remains, of this mental illness. So even if somebody in the urban area comes to you, how do you convince them that they should seek professional help? It's not very easy to do that because people are not receptive to that, right?
Right, absolutely. I agree with you. It's very difficult task actually. Managing patient is easier than managing their families. To tell you the truth, with the experience that I've had in Delhi itself and Gurgaon, it's very difficult to manage family, because once they come to a doctor, they expect the condition to go away within a week or 15 days of time. And that certainly is not the case when it comes to mental illness. Sometimes these illnesses remain for the lifetime. For we usually give an example to the families to make them understand that diabetes is something that you need to take medicine for like till the time that you're alive. Same goes for a mental illness like say bipolar or schizophrenia. These are the conditions that are more severe but are manageable through medicines, if the patient is in such condition to go back to daily life. But then comes issues like with the elderly, especially dementia, Parkinson's, and problems like these, when their motor capability is also hampered and their understanding and comprehension is also hampered. So when that is affected, the family members for a certain period of time are very supportive, but then slowly, gradually, in a large percentage, you will see that they don't want to bring the patient back for follow-ups, because they have realized that this is just going to deteriorate. They'll take the prescription and buy the medicines, and that's what they'll do. Rehabilitation takes a back seat. So for elderly, you will see that when they're in a certain condition, that when it is deteriorating, at some point they will also have these thoughts of self-harm, because they're not getting proper support. Same goes for normal cases in city areas, especially when you're talking about urban patients. Their expectations from a psychiatrist, from a psychologist, are very high, because they think that they're paying uh, sufficient money or sufficient fees or more fees for the patient to get better. It's lack of their understanding is basically like each time when they come to me, I reiterate the same thing, that see, this patient is suffering from this problem. The psychiatrist has given diagnosis. It will take lifelong medicines for you to manage him. But most of the time, it doesn't really register within the family. It is not lack of our professionality or our ethics or even in our orientation. It is just that how our society is being like, say you have fever and you go to a doctor, you'll get better within a week, right? So that's the kind of mindset they have, that no matter what issue they have for a particular period, they'll take treatment and they'll get better. So that meeting that mindset is a problem. Then stigmatization, obviously, like in a city, all sort of diverse population lives in a city, so they have their own cultural beliefs and system for doing things. So for a Bihari family coming to you, they may say that, oh no, we can change the doctor. Aapne galat cheez batayi hai, you told the wrong thing, the other doctor will give a better medicine. They'll change the doctors faster just to cure the illness as fast as possible, despite doctors orientation that this is not possible, right? And then they may take them back to the village if the person is suffering from neurological condition or suffering from some severe illness. The tendency is to take them back to the village. It's very like immigration or migration, migrants especially do that. Even if they are like financially well off to continue the treatment here, they just decide to take them back because they want to hide it from the rest of the community. Same for Haryanvi people, or even if you see in Bangalore, for example, if something like this is going on within the family, you will not hear about it. It's not something they will share.
True,
So
ma'am. Sorry to interrupt. What I was getting at is you're talking about once they come to you, but how do you make them come to you? You know, there are a lot of people who don't even accept that it is, something to be treated, or, something like that. They, for a lot of people, even in urban cities, it's something like, it's nothing, it'll go, it's a passing phase and things like that. Nobody takes it, as a serious
seriously,
condition.
yeah.
Yeah,
I
right.
agree. So
Yeah.
what I in the last session, what I told you was that basically currently what generation is ongoing. For example, people who are above 25 years old, they have a set mindset for these kind of things. But when you talk about the young generation, so to bring somebody to a health center, the condition needs to be severe. That's our society these days. So there are many awareness sessions that people do. Many local communities have started gathering for materials or even sessions or awareness programs for people to understand what they're suffering from is actually depression. The media is helping in that. Actors like Deepika Padukone and all these people. So generally, in our normal population, awareness about mental health issue is zero.
True.
Right, there is no awareness as such. They just acknowledge that yes, mental health issues are there, but they acknowledge the severe mental health problems, the neurological conditions, and as such they don't know how to differentiate between neurological condition and mental illness as such. So that awareness needs to be integrated, which is now in our education curricula, and in our schools we are teaching our children that. So it is basically what is happening is what I'm trying to get at is basically it's like a problem that has to be tackled in every aspect of our life for each generation. And that's what's been like, we are trying to do it, but the sheer size of the population, sheer size of the country, mixed with the diversity that we have, it's a very difficult task. And personally, I usually tell people that if around you, if you see a mental health issue, or if something you have identified, please go to that person, talk to them, and let them know that these things are available. uh, there are free helpline numbers you can approach for this kind of issue, and then there are clinics also that you can approach if you have more private tendency, like keeping it more invisible. Whatever suits you best, just try to get treated. That's what I usually tell our students also. Just make sure that the person is trying to get treatment. uh, Convince them as such that okay, you want it to be more private, you want to spend less money on it, or you want to just don't travel too much. Identify the centers around them and make sure that they understand that okay, this much is available around them and they can do it. And if you reiterate again and again, at some point when they're not able to manage on their own, or if they have more understanding of these issues, or somehow somewhere they're triggered by your suggestion, they'll definitely go and approach them. But it's not something that you can press people for.
True. No,
Right.
it's not very easy for people to accept something like this also. A lot of times when you try telling them this, they feel very I mean, they don't take it in a right sense. They probably get
Absolutely.
agitated about it or whatever. So yeah, I think it's a very delicate matter to be handled.
Exactly, and that's why I say that when you're handling something like this, it's always good to park yourself in a general approach of things. For example, if you've seen somebody talking about suicide or self-harm in a general conversation, you can just talk to them more, spend more time with them, share your story as an example. Okay, that I was feeling like this, and I approached a counselor, and then get an understanding of what their orientation towards mental health professionals are, or medical community is, and then give them your advice, like how they can tackle the problem that they are suffering from. But people are not very receptive in any sense when it comes to giving money for their own health. It takes a lot of experience on their end. For example, if they have uh, stumbled upon an bad experience due to that mental health problem, then they understand, okay, they have to go, it's time to go. So that's, it's a whole lot of other broad discussion to be had.
Thank you
But
so much, ma'am.
thank you for bringing this up, though. I am sure that it helped a lot of people.
Thank you.
Why in Delhi so many police children feel suicide? Police children? Can you please? I don't understand the question actually. I'm so sorry, Nupur. Why in Delhi so many police children feel suicide? To answer your question, Delhi has actually the large, like high number of reports on these cases. So the cases are reported here more because it's more monitored. Every school here has a counselor. It's mandatory for the government, from the government side. And private schools and government schools keep track of juveniles and adolescents that they're dealing with, for example. So that may answer your question. The uh, percentage of reports of such cases are higher than normal as compared to other places. And when you talk about competition in children here for education is extremely high. For education, for admission in a particular college, for example, I'll give you Delhi University. The cutoffs are skyrocketing high. It's 100% in some colleges. And adolescents here work really hard to get into a college, and they have to have a competition with the rest of the country as well. So when you are talking about admission in Delhi University and you're living in Delhi, that is the closest university that you can approach. And there are about 6-7 universities in Delhi itself. But Delhi University is the dream university that people want to go to. So when it comes to stress for education, it's extremely high. When it comes to career, that also is very, very, very delicate topic for students here, because they don't have any other choice but to go into service industry or business or say corporate area for work, and that's a competitive job. When you talk about migrant parents, so Delhi is a city which is very diverse and people from all areas come here. Once here, the parents don't want to send their children back, and it is not possible for a child who has grown up in Delhi and gotten an education in Delhi to go back to their village and adjust there, or start a career there. That requires a lot of effort, so they try to do it here. And one of the cases earlier shared, the student got 92 marks but still did suicide, thinking that that was less. And that's driven by the system that we have. So suicide rates as compared to other areas are higher in Delhi for sure. uh, but it's been, last 5 years it's been tackled really well by the government itself. Bringing in the happiness curriculum is a part of it, not just for the government student. Actually, here in Delhi, you will find that education is shifting to from traditional to other areas. When it comes to suicide rates amongst adolescents, that's how they dealt with it. They tried to bring in other educational methods for children. So you will find a lot of experimental schools in Delhi, which by the way charge a lot of fees, but they have methods of training For example, you would have heard a school in Pune where Radhika Apte was taught. It was a school where there were no exams till 10th standard and 12th standard. Same here as well. Some of the schools take exam only at a certain period of time. When they're 16 years of age, they give an exam and then move forward. So it's being like things are changing, but the rate is not as rapid as uh, the burden on children or even adults here, for example. I hope that answers your question. And obviously, not to miss out the normal conditions at home, domestic violence, abuse, alcohol. Uh, these are the driving factors. Drug abuse is also on the rise here. You'll be surprised to know that we have 20% rapid rates of elementary children using drugs. So that's a huge concern. That's like a red light for us. And the government is trying to tackle it right now here in Delhi. But that was the case back 2 years back, for example. That was the case because now the schools have been closed, so it's controllable somehow. All right. So I've shared the cases with you. I've shared how to manage situations if it comes to you. But let's talk about normal cases. We don't have much time. 15 minutes, I guess. Right, Emil?
Yes, we have 10 more minutes, ma'am.
10 more minutes. Okay, okay. So I'll just share a normal case with you. If somebody has, for example, uh, I talked about like had a breakup or had a fight with a friend, right? And these days, especially, you have less communication with many people. You only want to talk to certain people in your life because in COVID, everybody is working from home, or even if you're working from office, you don't interact much with other people. So what is happening these days is basically that once a person is facing the conflict with other one, the main person in their life that they talk to, they think that everything is done. They become more hopeless every single day. They get more our emotions are on the edge these days, so we get aggressive and more irritated faster than normal, and that's why our impulsivity is more driven, and we have more courage to try experimental things to harm ourselves or others as well. So this has been on the increase, so I want you to be on the lookout around you. This is like a exercise that I'm giving you, on the lookout for people around you who whose behavior you may have observed to be changing very soon. For example, they get aggressive, they get irritated, or they get quite they don't pick up their phones, or have been answering your chats after a while, uh, or are looking at Netflix more than normal, right? So the behaviors, getting into porn addiction, getting into like more writing, doing something that is not in their normal category of behavior. If they have started doing it, what is the reason for it and why it is happening? Just observe it around you and see how many people are actually affected mentally and what you can do in that situation. So that's something I wanted to do. Normally such kind of cases would come to you, but it's like from your own observation, when you observe people's behavior, when you perceive others to taking actions which are more negative, and language that is more negative language, for example, blaming themselves or blaming others, or finding causes to talk negatively about, be it about the government or COVID or anything else for that matter. And when you bring in a positive subject, not paying attention to that, and again changing the topic to something negative, these are the common signs of a person suffering from depression, or who is vulnerable towards getting into depression and then into harmful tendencies like self-harm and things like that. So questions, please, if any. If there's something that you'd like to ask or add here, or if you think that this session is lacking something, please feel free to point it out. I would change it for the next session, so it'll be helpful for others as well. Thank you, Swarnlata. All right, I think that nobody has a question. Thank you so much, Amal Raj. Back to you. More cases could be added. Thank you so much, Swarnlata. I'll try and share the cases with you after the session.
Thank you, ma'am. It was a great and enlightening session.
Thank you. Thank you,
Thanking
Amal.
all participants. See you all in the next session. Bye. Have a nice evening.
Thanks,
Thank you,
Simya, Amal. Thank you so much. Have a good evening.
Thank
Bye,
you.
everybody.
Bye, Preeti ma'am. For colleagues, please share your feedbacks. The link is already provided in your chat books and in your WhatsApp group. Please provide your feedbacks. And I'm Senia, leaving from this meeting. Thank you all. We'll see you soon.